Hello, my name is Ken Rodriguez. I am the Chief of Orthopaedic Trauma at Beth Israel Deaconess Medical Center, one of the Harvard teaching affiliates. I've been an orthopedic traumatologist for almost 20 years. And as you can imagine, one of the items in my practice that I deal with the most is the sequela of trauma. In this particular case, we're talking about stiff joints, as may happen after you sustain a fracture in your elbow, shoulder, knee, or hip. Stiff joints, or arthrofibrosis as it's called medically, is a very serious and limiting condition. It can affect motion, activities of daily living, and even ambulation. Arthrofibrosis can also happen not just from trauma, from many other conditions. It can happen after surgery, after a joint infection, after some inflammatory condition, and in a large number of patients, it happens as a sequela of neuromotor degenerative disorders. In some patients, joint contractures and stiffness can be so severe that it limits not only motion and activities, but even basic hygiene. Now, a few years ago, early in my practice, I had 3 young women who had sustained severe elbow fractures. They underwent surgery, and they were young, and they healed with the expected limitation in motion, and they went back to their lives. Coincidentally, a few months, or perhaps a couple of years later, they came back to me, and they had all restored full range of motion without any additional therapy or physical therapy or surgery. When I questioned them, the one thing they had in common was that they had all carried pregnancies to term, and they stated that it was during their pregnancies that the elbow motion gradually came back to essentially normal. This got me thinking that perhaps there was something about pregnancy that facilitated joint motion and the resolution of stiff joints. In fact, there is a hormone called relaxin that is made during pregnancy that from an evolutionary standpoint, it developed perhaps to facilitate pelvic distension to allow a baby to be born. Relaxin does have a significant effect on loosening up collagenous structures such as ligaments and capsules. In fact, anyone who has a significant other or spouse who has had a pregnancy can probably attest to that at some point during pregnancy, gait changes and the joints become more lax. It was the identification of relaxin as a possible candidate to mediate these results that led me to consider it as a potential therapy to treat stiff joints. I therefore approached my colleagues to see if we could develop a research program to study relaxin as a candidate therapy. It was with the assistance of Dr. Nazarian and Dr. Greenstaff that the initial work was developed, and that's how the company that we present to you today, Ortholevo, came to be. Thank you.